Would you like to be stronger? Would you like to improve your ability to function in day-to-day life? Would you like to improve your confidence? Would you like an increased metabolism to help with long-lasting weight management? Would you like to improve your body composition, reduce your risk of injury, improve your posture, reduce your blood sugar levels, improve your overall blood pressure, increase bone density? I could go on and on about all the benefits of strength training. Hi, my name is Christopher Schuff, and I'm a registered dietitian, licensed nutritionist, and board certified specialist in weight management. In this presentation, you will learn strength training mythbusters, foundational strength, and progressing your strength training. What has been your experience with strength training? Is it, I've never done it? I've tried it previously, but have never done it regularly. I've done it on and off in phases. It is usually a component of my exercise routine, or it is and always has been my main form of exercise. If you answered never or not regularly, today you will get to learn the benefits of strength training and how to start. If you answered that you do it on a regular basis, you'll find it useful to brush up on best practices that will help with your training routine. Too many people, strength training means lifting weights at the gym to increase muscle size. It is so much more than just this. In fact, many different types of exercise fall into the category of strength training, also known as resistance training. Examples include dumbbells, body weight exercises, core classes, TRX, Pilates, and resistance bands. Technically, strength training is any exercise you work your muscles against some sort of resistance to produce a force. Everyone should be doing some sort of strength training. There are just so many benefits. As you age, activities of daily living can become increasingly challenging. Strength training helps to offset this change and prevent falls. Prevent the inevitable muscle loss we experience as we age with strength training. Improve your body composition. Increase bone density and slow the rate of bone loss. This is especially important for women. Improve your posture. Improve blood sugar management. Increase your metabolism to burn calories, lose weight, and keep the weight off. Increase your confidence by improving how you feel about your appearance. The best news of all, you don't need to be in the gym for hours every single week to see these benefits. But there is a right and a wrong way to do strength training. We'll begin by exploring some common myths. Here's a history-based question for you. When strength training began to become popular in the 1980s, who was teaching everyone how to do it? Was it scientists and researchers, professional athletes, personal trainers at the gym, or anyone who looked muscular or strong? Well, believe it or not, the correct answer is anyone who looked muscular. There were no such professions as personal trainers and exercise physiologists in the 1980s, so patrons at gyms would ask the muscular-looking bodybuilders how to lift weights. Bodybuilders in the 1980s began to define what strength training meant for the general population and what it is today. Our first myth stems from the fact that bodybuilders helped begin the strength training craze. Myth 1. You need to train different body parts on different days. For example, on Monday, to do chest and biceps. On Tuesday, do back and triceps. On Wednesday, do shoulders, so on and so forth. Since bodybuilders began teaching people how to lift weights, people began to learn how to lift weights like a bodybuilder. Here are the 3 reasons you would need to train different body parts on different days. The only 3 reasons. 1, you want to bulk up like a bodybuilder. 2, you are training to lift as much weight as possible for a specific reason, like a competition. Or 3, you are lifting weights 5 to 7 days per week. Doing full body routines that frequently is not optimal. But for the vast majority of people, training your entire body all at once is better for you. Think about it. Your body functions as a unit. You should train it as such. Follow the guidelines we'll discuss later to bust through this myth. Myth number 2. If I want to reduce fat or tighten up a certain body part like my abs or my arms, I need to do tons of exercises for that specific body part. Please know that there is no such thing as spot reducing. Strength training exercises can increase the strength and tone of your muscles. However, they do not burn body fat in specific areas. We have no control over that. The best way to burn body fat is to control your food intake so that you don't store excess body fat. Also, aim to burn as many calories as you can, which is best done by a combination of cardio exercise, NEAT, and strength training. Myth number 3. I've been lifting weights for 2 weeks. Why am I not beach ready yet? Many people expect results much too quickly with strength training. Maybe it's all of those commercials that show quick results, but it just doesn't work that fast. You can begin to see slight visual changes after 6 to 8 weeks of consistent effort. To see significant changes, it takes months and months. Your body just doesn't change that quickly. The physiological changes take time. However, early on in a strength training program, you will notice that you are getting stronger. The reason is not that your muscles have already grown, but you are better able to recruit the muscle fibers you have. This is a neurological change. You become better at using the muscles that are already there. Even though you may not see visual changes right away, recognize your improved strength as a win. Importantly, to see any results, you need to be consistent. You can't work out twice, take 3 weeks off, then work out 2 more times, and expect to see great results. The bottom line, stick with it. You'll feel the results first, and then you'll see the results later. Here's another question for you. What do you think is the most important variable to be concerned with when strength training? Is it selection of exercises, amount of weight, technique and control, number of sets, or amount of rest between exercises? I'll admit, this one is a toughie because all answers are important variables to consider. But if I had to choose, technique and control takes the win. Your ability to control your movements dictates the exercises you choose, the amount of weight you use, and how long your workout will be. We'll discuss technique and control in just a moment. When starting a strength training program, you need to create a plan that is specific to you. This plan may be altered depending on how your first workouts go, but you need to know where to start. If you are restarting strength training after a few months or even years off, make sure you follow these instructions too, because your body doesn't just pick up where you left off. Step 1, choose what type of strength training you'll do. Consider choosing something you'll enjoy and something that will be easy for you to do consistently. Make sure there aren't too many barriers. Examples include body weight training at home, the weight machines at the gym, or resistant band workouts at the office. Keep in mind, you don't need to do strength training at the gym. Home workouts are great too. If you want to go to the gym, most gyms offer guidance from a fitness professional to get you started and teach you how to use the equipment there. Step number 2, select the exercises. To start off simply, aim to choose 2 to 3 upper body exercises, 2 to 3 lower body exercises, and 2 core or abdominal exercises. Then, order the exercises in a way that you don't work the same area back to back. For example, upper, lower, core, upper, lower, core. Step number 3, choose your sets and reps. Reps or repetitions are how many times you do the up and down movement within a set. If you're just starting, aim for 1 set of each exercise and complete 12 to 15 reps within each set. Think habit first, effort later here. Establish the habit of doing strength training before worrying about more weight and more reps. Step number 4, try the workout. You may have noticed that we didn't discuss how much weight to use yet. If your type of workout uses weight at all, that is. The first time you do a workout, use a weight that is lighter than you think you should use to ensure you have good form and technique. If you can successfully complete the first workout with good form, then try the next weight up for your next workout. Continue this pattern until you find an appropriate weight for each exercise. Note, you may have different weights for different exercises. An appropriate weight is a level that challenges your muscles while you still maintain control and technique. This is crucial to remember. If you can't control your movements, you are likely using momentum and gravity to cheat. This is counterproductive. Your muscles aren't doing all of the work, and you're using more weight than your body can actually handle. That's a recipe for injury. Step number 5, adjust if necessary. If you need to change the selection or order of your exercises, that is completely okay. If you have diabetes, keep in mind that any change to your exercise routine may have an impact on your blood sugar. Make sure to increase the frequency of blood sugar monitoring when changing your fitness habits. Aim to check your blood sugar before, during, and after exercise. Consider this. Are you the type of person that has wanted to do strength training but has not known where to start? Start simple. Choose an easy form of strength training like body weight exercises that you can do at home. Choose a couple of exercises for your arms, such as push-ups and arm circles, a couple of exercises for your core, like plank holds and crunches, and a couple of exercises for your legs, like squats and lunges. Aim to do 1 set of these exercises 1 day each week just to start. Here is another question for you. Which of the following statements about strength training is true? Is it working through a full range of motion causes injury? Warming up is not necessary before strength training. For breathing, exhale as you lower the weight. Master tempo before adding more weight. Or proper tempo is 1 second up and 1 second down. True. Mastering tempo before adding more weight is the true correct answer. Let's examine why the other answers were false. Working through a full range of motion causes injury is false because working through the full range of motion can actually help to reduce future injuries. Warming up is not necessary is false because cold muscles are more likely to get injured. Exhaling as you lower the weight is false because it is actually the opposite. Exhale as you exert to lift the weight. Proper tempo of 1 up and 1 down is false because 2 to 3 seconds up and 2 to 3 seconds down is correct. For many people, the following guiding principles for strength training will make their workouts more challenging, so are a good place to start. Why? Because the following principles are often cheated on during strength training workouts. So if you stop cheating, you will produce better results. Before worrying about adding weight or more exercises to your workout, make sure you are doing all of these things. First, warming up. Always warm up with some light cardio and easy exercises that prepare your muscles for strength workouts. Warm up for around 5 to 10 minutes. Next, breathing. There is a proper way to breathe when strength training, whether you're lifting a weight or lifting yourself. You should exhale on exertion when the resistance is moving against gravity, so to speak. Then inhale as you lower the weight. Next, tempo. This is along the same line of control and technique as we discussed earlier. Lifting weights faster is not always better. You'll use momentum and gravity rather than your muscles. Before worrying about adding weight, see if you can slow yourself down and still complete your exercises. It should take 2 to 3 seconds to lift the weight up and 2 to 3 seconds to lower the weight down while working through the full range of motion. Are you shortening your movements to make the exercise easier? Ensure you are moving through the full range of motion to truly complete the exercise. Okay, honestly, are you skipping on any of these principles we just discussed in your strength training workouts? Many people do. We are often only taught to lift as many times as possible and as heavy as possible. Strength training is much more than just how much you can lift. After mastering breathwork, tempo, and working through the full range of motion with your strength training exercises, then it's time to progress further. You can progress your strength training by altering one of the following variables at a time. Add more weight. Increase the weight one level and see if you can maintain control and technique. Add more days per week. Have you been strength training 1 day per week? Bump it up to 2, or from 2 to 3. No need to do more than 3 days per week though. Always do strength training on non-consecutive days. Try adding in cardio on the other days if you want to exercise more frequently. Add sets. Increase from 1 set per exercise to 2 sets per exercise. Change up your exercises. If you've been doing the same shoulder press machine to work out your shoulders, try the lateral raise machine instead. Depending on your goals, make slow and steady progress to eventually achieve the following strength training routines. For the goal of general fitness and toning, complete strength training workouts on 2 to 3 days per week. For each workout, complete 8 to 10 different exercises. For each exercise, complete 2 sets. And for each set, complete 10 to 15 repetitions. Got it? For the goal of adding more lean muscle and trying to bulk up, complete strength training workouts on 3 days per week. For each workout, complete 10 to 12 different exercises. And for each exercise, complete 3 sets. And for each set, complete 6 to 10 repetitions. Envision this scenario. You now realize that your strength training routine is pretty messy. You haven't been considering your technique or your tempo. You were the person that would put as much weight as you can on the machine and do whatever it took to finish those 10 reps. But after mastering your tempo and control, you become ready for a new challenge. You decide to progress your strength program by focusing on new exercises. You select new exercises using dumbbells to change things up and challenge your body in a new way. As a result, it mixes it up, helps you progress, and you even become stronger. Let's summarize today's topic with some goal setting on the functional strength foundations and progressing your strength training. If this topic really resonated with you as something you need to work on, please consider adding one of these goals to your current list of healthy habits. However, if you've been struggling lately, don't worry about adding a new goal today. There's no need to overwhelm yourself. Instead, focus on your current goals and write a new goal from this session on your calendar for a future week. Potential goals to build a strength training routine safely and effectively into your lifestyle include: I will start strength training 1 day per week with a focus on control and technique. I will ensure proper breathing, tempo, and range of motion in my strength workouts before adding more weight. And I will commit to completing 2 strength workouts per week for the next 2 weeks.